Good morning, and thank you all for tuning in for this Denver COVID update. With me today, of course, as always, is Bob McDonald, Executive Director of Denver Public Health and Environment. To start off, we have some good news. To date, nearly 300,000 Denver residents have received at least one dose of the COVID-19 vaccine. That's almost 40% of our entire population, which is very good news. The governor today and I joined the vaccine event that was taking place at Blair Caldwell. It was the Special Olympics vaccination event, and I want to thank everyone who was involved, Denver Public Libraries, of course, Special Olympics of Colorado, Denver Health and hospitals for their tremendous work that's going on out there. But it's these type of events that are helping us to get shots into every arm. Every shot that gets into the arm of one of our neighbors gets us one step closer to defeating this virus and getting back to normal. And I cannot stress enough how important it is for as many Denver residents as possible to get their vaccine as soon as possible. Vaccine hesitancy, especially among certain segments of our communities of color, remain a challenge that we're working hard to overcome. But as we approach that point where access is no longer a barrier, one of the best tools to overcome this challenge is you. If you have family, friends, or neighbors who are hesitant to get the vaccine, do us all a favor. Talk to them, support them, encourage them to get vaccinated so they can keep themselves and those around them safe and healthy. These vaccines are how we're going to beat this virus once and for all. So why is getting the vaccine so critical right now? It's because at the same time, we're seeing more and more supply come our way, even with the unfortunate news of the pause with the Johnson & Johnson vaccine. We're also seeing cases and hospitalizations remain a bit higher than we'd like. We're definitely in a delicate situation right now. It's a balancing act, though. It's between being able to further reopen public life and being able to maintain public health. We can do both, and towards that end, we'll be taking a few important steps that I want to share with you right now. First, we're issuing a revised mask order that takes effect today, Wednesday, April 14th. In alignment with our metro neighbors, as well as the state, our new order will remove the requirement for face coverings in outdoor settings. Masks will still need to be worn indoors by anyone 3 years of age and older, as well as on public and shared transportations per CDC's guidance. The new Denver mask order will expire after 30 days, and we will reevaluate whether we need to extend it as we get closer to that date. Second, as you know, the state is making its COVID dial system optional for local jurisdictions starting this Friday. The state's decision means that a number of Colorado counties and local jurisdictions will not maintain restrictions. There's nothing we can do about that, but we will be taking a different approach in Denver. Based on key public health factors, including vaccination rates, variants, case rates, hospitalizations, and deaths, we believe it is necessary to maintain many requirements and restrictions in the dial for at least the next 30 days for both indoor and outdoor settings, while continuing a phased relaxation of certain limits. So Denver will be issuing a new public health order that will adopt certain elements of the dial. Effective this Friday, April 16th, Denver will adopt level blue capacity limits for most indoor categories such as restaurants, offices, and retail. And we aren't doing this alone or in a vacuum. We have worked hard to coordinate with our regional partners, and most other metro area counties will also be making the same shift to level blue. While indoor settings will be able to operate under level blue limits, this new order will also provide some capacity limits for outdoor events, which Bob, of course, will go into more detail here in just a moment. So, like our revised mask order, this revised public health order will be in effect for at least 30 days, and we will reevaluate whether we have a need to extend it as we get closer to that date. Until the vaccines become more widely and readily available, it's important to keep these measures in place so that we can keep a lid on the spread of this virus. Certainly, we're dealing with a different landscape now than we were dealing with just about this time last year or even last fall. While the threat is lessened today for older adults and other vulnerable population thanks to this vaccine. Variants that are more transmissible and potentially deadlier could put us all in a difficult spot very quickly. So even with these first steps in a measured relaxation of limits, we still need everyone to keep doing their part. So here we go. Keep wearing your mask, particularly when you're indoors. Social distance when you're indoors and outdoors. Don't gather in large groups. And please, by all means, get vaccinated. We still have 2 highly effective vaccines available to the public that have an excellent track record and have been administered hundreds of millions of times now. We're so close. We got to keep our eye on the ball, and we got to get this done. We got to get it done for ourselves and for everyone else in our community. With that, let's bring up Bob McDonald from DDPHE. Bob? Oh, let me get that. Thank you, sir.
Thank you, Mayor. Good morning, everyone. Let's go ahead and dive into the slide deck here. As you can see throughout the state, many counties, including those counties that are surrounding Denver, are still in the yellow phase based on the dial as it exists today. We'll talk about case rates here in a minute. Moving on to the next slide, you can see the epi curve that we've been looking at ever since the pandemic started here in Denver. Take a look again at the tail end of that. Case numbers are going up. And the reason they're going up is because the variants that we're seeing, which are predominant now in Denver, they're more infectious. And so in spite of our success with vaccinating up to 8,700 people a day here in Denver, numbers are still climbing. So we need to get vaccinated. Everybody needs to keep wearing the face coverings until you get vaccinated. And I want to talk about the importance of getting vaccinated here in a few slides. So with that, we can move to the next one. Again, these are some of the metrics that we have looked at from the beginning. These are metrics that we're going to continue to look at. But in addition to these, we're going to focus a little bit more on the severity of cases and hospital admissions, perhaps more so than we did at the beginning. We know now that 150 cases is not the same as 150 cases early on, when those cases were primarily within our elderly population. We know that it's a younger demographic now where we're seeing an increase in cases, and also medical treatment is better, but we can't dismiss these metrics. We're going to continue to look at these and look closer at hospital admission rates moving forward. With the next slide, you can take a look at some of the statewide changes that the mayor referenced earlier in terms of the state modifying its face covering, only requiring it in certain indoor settings, and there is a capacity limit when under the state's mask order when a face covering has to be worn and when it doesn't. One of the things that we have tried to do here from the beginning of the pandemic here in Denver is to let's keep it simple. We recognize that the more complicated our orders are, the harder they are to enforce, the harder they are to understand by regulated businesses, the harder they are to understand by citizens. So we're going to keep it really simple. We're going to extend our face covering, just make it mandatory in indoor public settings. Of course, you don't have to wear it at home. It's encouraged to wear it outdoors where you can't physically distance, but we'll be lifting that requirement in our own face covering order as of today. The dial itself is being modified by the state. It becomes discretionary on Friday, but we think that we need to slow down a little bit with just dismissing the dial altogether. We're going to move into the blue phase. See how the virus responds, see what the data looks like. It's possible at that time we could move to the green phase, we could lift public health restrictions altogether. Hopefully we do not have to reverse course. That is largely dependent on people getting vaccinated, and until they do, wear that face covering. Next slide, please. So again, Denver's modified face covering order goes into effect today. Not required to be worn in an outdoor setting. We still, again, encourage it where you can't physically distance from those that are not within your household. It will expire 30 days from now, and then we will revisit it. The broader public health order, which adopts most components of the blue phase of the dial, will go into effect on Friday. But we're going to modify some of the things with respect to what the dial indicates with outdoor settings. We don't want to go from a capacity of 175, or in some cases where variants were granted and there's a slightly higher allowance. We don't want to just go from that to thousands and thousands of people congregating, even in an outdoor setting where it's safer. So we'll talk about that in the upcoming slide here. So again, we will move from yellow to blue. We're going to take a look at all of those metrics, particularly, again, focusing on the severity of cases and what those snapback provisions would look like. And then in outdoor settings, we're going to set that cap. Anything under 5,000, 5,000 people congregating, we're going to require a mitigation plan. We're going to provide guidance along those lines. But that plan will not necessarily need to be approved, but we're here to provide guidance on that. That said, any outdoor event, 5,000 or more, the coordinator will need to consult with the public health department before they move forward with that event. We'll maintain the 5-star program as it currently is outlined within the dial, so we won't be making any modifications there. So there still are some additional allowances for certain types of businesses moving into the blue phase of the dial. Again, we'll reevaluate that in 30 days, and the order itself expires in 30 days. So with that, we're making a lot of progress with vaccinations. Again, 8,700 doses administered a day, hundreds of thousands, 300,000 throughout the city of Denver. And I want to just stress something, a comment the mayor made earlier, hundreds of millions of doses of Pfizer and Moderna have been administered with little to no problems. So I can't reinforce that enough. And then finally, again, you know, we want to get to that point where all of these little people on this slide here go from blue to orange, right? Everybody's getting vaccinated. So we hope to do that in the upcoming weeks. We're keeping pace with the state and the U.S. as a whole, but we need to keep pushing that, getting it. We are going to get to that point eventually where we have more vaccine than people who want to receive it. That's going to be the point where it's really challenging. We got to get over the fear of these vaccines, and I can't reinforce enough how effective they are and how safe they are. With the next slide then, why get vaccinated? Out of all the points I want to make today, these are probably the most important ones. Just like the face covering itself, it's not just for you. It's not just for us as individuals. It's for everyone else. We wear face coverings to protect everyone else. When we get vaccinated, we protect ourselves against the virus, but we're also protecting others, okay? So the more people that we have unvaccinated, the more we can transmit it. Those people who are unvaccinated can transmit the virus to others. And those others may not have been vaccinated yet. And even our young individuals, I'm reaching out to, calling out to you now, get vaccinated. Because again, it's not just for you. You might think you might resist or be able to defend yourself against the impacts of this virus. But if you are unvaccinated, you can still transmit it to somebody who may not survive. And so it's important for everyone, particularly our young adults. Now's the time for you to get vaccinated. And the more people that are vaccinated, the less this virus mutates. The more it mutates, the more all of us are at risk because the vaccine that we received might not be effective anymore. So get vaccinated. It's going to be easier to get that done in the upcoming weeks, so I encourage everyone to do that. And with that, same messaging here. Just as important as ever, as we're on the home stretch here, keep wearing that face covering now, especially with these variants that we're seeing. They are more infectious than the original strain we saw last year in March. And with that, I'll turn it over back to the mayor.
Thanks, Bob. And I want to just reiterate the graphic where he talked about turning everyone orange, how important that is just in time for Bronco season. So thank you for pointing that out. Let's go ahead and open it up for question and answer.
All righty. Vicente, do you have a question? You will need to press *6 to unmute yourself.
Let's go ahead.
Vicente? All righty. John Daly with CPR. Do you have a question? You will need to unmute yourself by pressing *6. And if we miss you, we'll come back around. Connor with CBS 4.
This is Connor.
Go ahead, Connor. We can't hear you.
Okay, sorry. What level of collaboration has there been with Denver and other metro area counties. Why do you guys see that is important with this health order? And what level of concern is there for any counties that already have or may still have much looser restrictions?
Well, I've heard two questions there. The first is what type of coordination took place with our regional partners surrounding counties in Broomfield and Boulder. Much of that work is done through a collective that's called the Metro Partnership for Health, the Metro Denver Partnership for Health, which is the surrounding counties, Tri-County Health Department, Jefferson County Health Department, Boulder and Broomfield, and our partners at Denver Public Health. Strong representation from our Chief Medical Officer at Denver Public Health, Dr. Bill Berman. We've been talking for weeks about what we will do when the state devolves the dial to locals, and we are very much in alignment, all moving to blue for 1 month, evaluating our face coverings, our orders are in alignment, and that's key because one of the things that leads to a higher level of non-compliance is confusion. The more confusion we have, the more non-compliance we have with public health orders, the more non-compliance we have, the more cases go up. So that is key on the home stretch here. So we are in alignment throughout the region on that, and I want to thank all of our partners from those counties, and of course our Chief Medical Officer, Dr. Bill Berman at Denver Public Health. And the second part of that question, what risk is there with counties that are going from whatever level of the dial that they're in to nothing? I can, it's hard to say. What I'm comfortable saying is the risk is much higher. I think it's a mistake to move from whatever level of compliance we have based on the dial to nothing. I think that's too fast. I think it needs to be phased, and that's exactly what we're doing throughout the region. That's the right balance to take.
And let me just add that from the point of view of mayors, we started conversing, of course, immediately after learning the governor's decision to transition the dial. And just as we did at the start of this pandemic, we all committed to remain in conversation and good communication with one another about how we would move forward and try to stay aligned and continue to be guided by the data.
Alrighty, Vinny with Bloomberg. You will need to unmute. Go ahead.
Can you hear me now?
Yes, sir.
Okay, good. Thank you very much. This is Vinny Delchudes at Bloomberg News in Denver. Hello, Mayor and Mr. McDonald. Question on J&J. Will Denver resume the J&J vaccines when and if there's an all clear given from Washington? Thank you.
Well, I think the answer to that question lies in what research and what is understood about the experiences of the 6 individuals that had some severe impacts from the J&J vaccine. And I guess before I comment any further, I just want to say our thoughts are with those 6 people, and particularly the person who lost their life to that complication and to that person's family members. We're just going to have to evaluate that as we go, but I want to stress this, that first of all, the city has not used much J&J vaccine. Our plan is largely relied upon and will continue to rely upon Pfizer and Moderna. Pfizer and Moderna, again, hundreds of millions of doses have been administered throughout the country, and we've not seen any problems with that. Our plan was solely or largely based on that. It will continue to be largely based on that. This rare occurrence with the J&J vaccine, which is a different type of technology than the 2 vaccines that the city's largely relying on. We're just going to have to evaluate whether or not we roll that back into our vaccination plan, depending upon what further research indicates.
All right, Seth with the Gazette. Oh, go ahead.
Teresa, okay, I have one follow-up. Regarding recent hospitalizations and fatalities in Denver, have you seen that move toward the younger group? I know any infections are up in that category, but are the hospitalizations and fatalities moved into the younger group, dominating it versus seniors? Thank you.
Yeah, well, of course, the more cases you have, even in a younger demographic, the more you run the risk of there being fatalities. So there have been more fatalities, but again, the fatality rate overall, the mortality rate is very, very low at this point in time. And cases among younger individuals continues to decline a little bit, particularly in the last week or so, largely due to vaccines. So that's what we're seeing. We're going to keep a close eye again on not just the admissions, but the severity of cases and mortality. That's really the driver in terms of the decision making moving forward.
All right, Seth with the Gazette.
Yeah, thank you. Two questions. First, John Douglas said yesterday that in 30 days the dial is effectively going to go away, and then we'll enter a few month long observational period where measures can put back into place if numbers go up. Is that the plan? What happens in 30 days when these orders expire? And second, what are the baseline protections that the state is going to keep in place? It sounds like it's going to be a lot of indoor events, but what's your understanding of what they're going to do there? Thank you.
Okay, well, the first part of the question is, in surrounding counties, in their orders, they have included a 90-day observation period after this 1 month in blue. That is not included in our order, but that doesn't mean we're not going to do it. And in fact, I would suggest that we're not just going to evaluate what's occurring 90 days after the blue phase. We're going to be evaluating this through the rest of the year, particularly as we move into the fall months again. We're always going to do that evaluation. I think that's a long-term effort just to make sure that we suppress cases as much as we can. The state's focus moving forward is going to be on indoor settings, particularly the large indoor settings. That makes sense to me. The more people you have, the more transmission you can have, and we know that indoor settings are more risky than outdoor settings. So they will implement that. They'll keep their fingers on the pulse of that, at least for the next 30 days, and then we'll work closely with them to see if that part of their effort also devolves to local public health.
Alrighty, Maggie with Denverite. All right, John Frank with Axios.
Yes, hi. Thank you. Two questions, I guess probably for both of you. Mayor, do you feel like it would be too soon to even lift some of these restrictions we are lifting, that is, go to level blue, given the numbers we are seeing? And Mr. McDonald, I'm wondering if you can dive in a little more about what it means for Douglas County in particular to be, lifting all restrictions, and whether that is going to hurt Denver's efforts to combat COVID-19.
I appreciate your questions, and certainly we've had these conversations internally about the messaging that we are giving. One, we're looking at numbers, some rising in terms of cases and hospitalizations. But we're also beginning to dial back some of our restrictions. This is about the effort, the art of finding the balance. And we have been focused on this for quite some time now, recognizing that this city has to be open for business, but we also got to keep people safe. I think the difference here, as opposed to last year this time or even this past fall, is we have the vaccines. And we are, as we pointed out earlier in this presentation, 40% of our people have at least one dose of the vaccine. That's pretty good, and we are on track to continue. Just imagine if 40% have at least one vaccine, in a matter of a couple weeks, we're going to have quite a big percentage of our people who are fully vaccinated. And so we are on track with regards to the vaccine, which helps us manage, I think, the severity of the virus in our community. And I think that's the important variable that we have been focused on. And so we are working to find that balance and also keep the business open while at the same time protecting everyone. Bob?
Well, Douglas County, as everyone knows, that is a county that falls within the jurisdiction of the Tri-County Health Department. And as I mentioned earlier, Tri-County is a huge partner in the Denver Metro Partnership for Health. And I think, the director of that department has done a good job trying to express the concerns with going from any phase of the dial to nothing. It's anytime we have counties that are close or surrounding Denver that throw requirements out the window, it presents an elevated risk to Denver. I would just remind those outside of Denver, when you're coming into Denver, we do have restrictions that will remain in place, and we need visitors to Denver to comply with those. As I said, I think it's risky. It's a risky move to do that. I think it's a little too soon, and we're certainly not going to do it here in Denver.
One quick follow-up, if you don't mind, just because you brought it up. Is it too soon to go to local control in your mind?
Great question.
Well, I think it presents some challenges for sure, but I think it also presents some opportunities. You know, when you have state-level orders, that facilitates consistency. But state-level orders, it's really hard to detail those such that you're getting into the nuances of every community. So while I understand the state's decision, and I can appreciate that they want to turn this over to local public health, there's some opportunities there. Again, the big challenge is consistency, and I think we address that head-on by reaching regional consensus with our surrounding counties.
And I'll tell you just from a local level that we have remained and we started and will continue to be in close partnership with the state, regardless of who is controlling the dial. And to us, it was never about controlling the dial. It was about making sure we have good policy led by good data going forward. We put the slide back up, which shows at least 41%, almost 42% of our people have at least one dose. If you're looking at 3, maybe 4 weeks in between each doses, you can see that by the end of May, where we're going to have a large percentage of our people vaccinated in Denver, Colorado. That, to me, shows great forward momentum with regards to vaccinations.
Is there anyone we missed?
This is Ed Seelover.
Go ahead, Ed. Ed, go ahead.
Oh, great, thank you. Yeah, I wanted to ask about the aspect of 6-foot social distancing. I know that some business owners have been concerned that even at 100%, this continued requirement to do 6-foot social distancing is going to keep capacity way down. So tell me how you're looking at that. Doesn't sound like you're addressing that, or, I mean, do you imagine that's going to stay in place for a while, or how do you look at that, especially with the balance the mayor has talked about striking between keeping business open and keeping people safe?
Well, listen, you know that we know from the beginning of the pandemic that there are three or four primary controls: face coverings, of course, hygienic practices, and physical distancing. And we can't bail out on those quite yet. So I understand that you know that 6-foot distancing where it still exists in certain venues that does present some limitations. But I can't stress this enough. This is a 1-month order. So I think that sends a message, that and the face covering order. We're at that point now where we can look at things month to month. So if we can get the business sector and citizens to hang in there with us, we are on the home stretch here, and we hope that we can lift the remainder of these public health orders in the very near future.
All right, last question.
All right, we'll go ahead and wrap up. Let me thank Bob again for constantly being on post and being here for the messaging. As we wrap this up, I think it's important to note that this city is open for business, and I want everyone to understand that we are making decisions that are guided by data and by the presence of the presence of the vaccine in our community, and the fact that people and institutions in our community are doing such a good job in getting needles into the arms of Denverites. So we want to thank everyone for the work that they're doing. Keep doing it, but we got to continue to do what we've been doing as